Hi, Mr. Adams. First of all, I would like to thank you for coming in to do this video today. My hope is that people out there watching will hear about how helpful Suboxone can be and maybe consider trying it. First of all, can you tell me how you got started using drugs, like how all that began?
Um, from what I can remember, the best about it was I was getting ready to turn 18 years old, and I was actually around other drugs growing up, but mainly stuff like pot and
And you say around, I mean friends, family? Like,
friends, not family.
no,
You
friends, okay.
know, I wasn't born into it, but the friends that I kept around sometimes, I almost felt like I'd achieved something by hitting 18 years old and not doing anything. I'd tried marijuana before, but I'd never tried anything hard.
Okay.
And I guess I thought I was a little bit too big headed and thought that I was different than people and that I could take something and control it better because that's just what it told me at the time, man. I had a lot of work to be doing at the time. I was helping my friend run a restaurant. And
So how did you get started actually using? What was that, as they say, the straw that broke the camel's back?
somebody had suggested me taking one of their Vicodins that they got for a tooth they had work on. And it was also my girlfriend at the time.
Okay.
So I guess I was a little peer pressure too.
Sure.
And, I did it and I felt like, oh my God, I found what was missing or something,
It
like,
made you feel good.
yeah, but I still had that kind of bad feeling that, good stuff ain't always good. And, it just progressed.
Well,
Vicodins went from Vicodins to Percocet. Percocet led to Oxycontin.
Okay.
Oxycontin led to can't find what you want and have to settle for heroin.
Heroin. Okay.
And
Did you ever shoot up heroin?
for a short time,
Okay.
after I'd already went and had tried methadone treatment.
Okay, so you did try methadone.
Yes.
What was that like for you?
It was refreshing to be off of the scene.
But
I had to driving around looking every day.
Okay.
And,
Well, did you still feel like you were kind of addicted to something when you were taking methadone because you had to have it?
yeah, I
Yeah.
did.
Okay.
I did. I felt the addiction thing, if anything, more than before.
Okay.
Like a very strong bond to me,
Well, tell me some of the things that kind of being an addict. What have you lost in your life?
I'm sure there's a lot that I'm not even aware of that I've lost, but
Do you ever spend any time in jail?
that's what I was going to answer. My best answer for that is freedom.
Yeah.
A lot of freedom, and
freedom.
that's being in prison and being not in prison. They took my freedom away. I had to report to somebody for years, and I felt like I never got out of that.
How long were you in jail for?
The first time, 3 months. It progressed just like the pills did.
Yeah.
8 months, 13 months, and then the last time, when I did my biggest sentence, I actually went in doing good. I was doing the Suboxone right, and I was doing good, and I went and pulled the rest of my time just to finish everything.
Okay.
So several different sentences, yeah, and it was all because of drugs. Yeah.
Well, tell me, what made you decide to try Suboxone? Like, how did you hear about it?
The first time I tried it, it wasn't by choice. It was by somebody saying that, this will help, if anything, until you can find something else.
So you were afraid of going through withdrawal, is that right?
Yeah. So I took it to keep from having the withdrawal.
Okay.
And back then, I also, of course, took it because I was looking for my high that I was used to having.
Did you get high on Suboxone?
No, I didn't.
No.
I didn't get high on Suboxone, but I was fooled at first because
Okay.
you want to think that you're high if you're not feeling that pain you've been used to feeling.
That's
And
true.
it took the pain away, and it allowed me, like,
To function.
a breath of air, as if you were diving underwater. It gave me a breath of air to stay down longer or something, like I had a better fighting chance then.
Okay. And so tell me, when you got out of jail the last time, what made you decide to get on it, quote unquote, for real, like legally, have it prescribed to you?
I guess thinking so many times that, with the methadone and with other stuff that I had it beat, and then learning how quick that you can use them type of drugs, opiates and stuff, for years and never have nothing go wrong, but it's just that one time you're dead. And I guess I cared a little bit more about what other people thought then, because I was getting my conscience back, and I didn't want my family to have to deal with losing me. If it didn't matter to me at the time, it mattered
Your family.
to my family. Yeah. So.
Do you happen to know anyone who has overdosed on opiates?
Yeah, several people.
Several.
And I mean, at least once a month, we'd have a reef on the door of the clinic from people just mixing with other drugs with their medicine,
Yeah.
So, yeah, it's dangerous.
It is. It's very, very dangerous. So how have you been doing since you started the Suboxone program here?
Since I started up here, I've been doing better than the last time that I tried to take it at the other doctor's office.
What happened at the other doctor's office? Do you remember?
The other doctor's office was just simply there to, I don't never even remember talking to the doctor about my problem or nothing. I think I talked with the nurse a little bit, but...
Just giving a script, basically?
He would ask me sometime when he come in there what I was there for. Like, I was another patient or something, so I guess it made me not take it as serious.
Right.
And I just, thought I was prepared to do it, and then I ended up having to be taken off, not because I messed up, just because, I didn't, I'd already gotten in trouble before, and, the probation that I was on, they didn't want me going to him because of that type of reputation right there about him not even knowing his patients.
Gotcha.
I guess you could say he had a kind of bad name, and they made me come off of it with no kind of help at all. Yeah.
Well, since you started coming to this clinic, how have you been doing?
Of course, I've been doing great, but I've also felt a lot safer. Just like even when I'm sitting in my house, sometimes I think about back in the day or something, and it scares me. Naturally, it scares me that some of that drama is going to just pull up in my front yard all of a sudden, and I know that if I'm going here, that I'm safe from all that I don't have to, because I've got a doctor that I can talk to that's willing to
you find that
help
helpful?
me. Yeah, I mean.
You find it helpful to talk about stuff as well as just taking the Suboxone?
That and the security, and overall just not using no more. I mean, I never knew how much I didn't want to use, until I didn't do it for so long.
And are you working again now?
Yes, ma'am, I am, and I actually want to get up and go in. I enjoy it.
Enjoy it, okay. Well, let me ask you one last question. What would you say to anyone out there who may be listening to this video and who's an addict?
Well, I'd say that it's definitely worth trying, even if there were other options. This is the option that worked for, all addictions are different. I don't feel mine was special in any way, but I do feel that I had a very strong addiction. And if it worked for someone like me, I don't see why it couldn't work for other people, but it takes you wanting to. If you go to take it and you don't want to actually do that, and you're using it for the reason I did the first time I tried it, it's not going to work for you. But, it's such a relief that I don't have to feel like a zombie too, because the methadone does that.
Yeah.
So, but it takes time too. I would say that too, that it might not always work your first day. You might need to wait and see how the next day goes,
I was going to ask you, how many days do you think it took you before you felt like, quote unquote, normal again after you started taking the Suboxone?
For the first time or this time?
this time?
This time, yeah, it was instant right away. I had experience with it, so
Mhm.
I knew what I wanted this time, and yeah, it made me feel better, right away. And I've seen it would have to be a very good reason to use.
Mhm.
It would almost have to be life or death, someone with a gun to my head, because
So you don't have any cravings at all anymore?
no, and if I did, I wouldn't feel nothing if
That's
I did
right.
it.
That's
I'm
right.
always protected by, I would have to go and be sick for 2 or 3 days
Mhm.
before I could ever even feel something else. Now that's insanity. Being sick to wait and feel something else. So I guess the main word there is protection. I feel like my body's got a.
You feel like the Suboxone protects you, is that
Yeah,
what you mean?
like almost like a
Yeah.
personal alarm, and I'm blocked from it.
That's right. Yep. Okay. Well, thank you very much again for your
You're
time,
welcome.
and
I hope I was helpful.
you were, and I hope you continue to do well. Okay.
Thank you very
Thanks
much.
very much.